Hey, I'm Jason Lichtenthal. I'm on the Newcastle Town Board, and welcome to the weekly Lunch and Learn. As you may know, the weekly Lunch and Learn, it's a series held on Zoom every Wednesday at 11:30 a.m., co-sponsored by the Chappaqua Millwood Chamber of Commerce and the Town of Newcastle. Each week, we're going to focus on essential topics with important information and updates that are going to be relevant for many different sizes and categories of small businesses and merchants. If you have any topics that you'd really like discussed or would like to recommend a presenter for one of our Lunch and Learns, you can email Dawn Danker-Rosen, who will speak in a minute, at ddr@ddrpr.com. And we're looking forward to another. I find these Lunch and Learns incredibly valuable for not just myself, but for my business as well, which has been really helpful. So without further ado, Dawn Danker-Rosen.
Hi, just want to welcome everyone. We're really excited about the timing of this event as we hit phase 2. And we're going to get some insight and info on reopening safely and staying open as per the state and CDC guidelines. As Governor Cuomo has said many times, it's not just a matter of flipping on a switch. It's actually a pretty complicated endeavor, many guidelines to meet. So there have also been many news reports that show how employers now are acting as medical professionals and being asked to diagnose whether their employees have coronavirus. And that's a pretty big challenge. In addition to that, Louise actually this morning shared an article with me that ran in the New York Times, which described office environments now being similar to biohazard labs. Imagine that. And I just I love this quote because it just opens this up to the need for this conversation. The article says, now that the Centers for Disease Control and Prevention has recommended sweeping changes for American offices, companies around the country are preparing elaborate new routines intended to keep their employees healthy. In many cases, the changes will transform workday offices into fortified sites resembling biohazard labs. And they go on to say, why even open it so hard? So here we have two professionals here and experts that can kind of make sense of all those rules and guidelines and talk about how you can safely reopen and effectively and the big task and stay open. So, but before we go on, I'm going to turn this over to Rand Manassi, the Vice President of the Chamber, and he'll share a few words about our program for next week and his insights as having a company who just opened in phase 1.
Thank you, Dawn. Yes, I'd like to first tell you about next week's program. Next week, we are having a continuation of this week's program. It will be, again, June 16th, the same time, same station, 11:30. We're going to have 3 guests to continue talking about safely reopening. We're going to have Shalita Amler, the Commissioner of Westchester County's Commissioner of Health. Shalita has been devoted her life as a public service over 3 decades. She's been appointed in 2011 the Commissioner for Westchester County Department of Health. She has led and supported many successful public health initiatives and has played a significant role in the campaign to reverse the rising death toll for opiate abuse. She's managed many services that are in place today to protect and ensure the health of more than 1 million residents and workers and visitors. Dr. Amler is president of the New York State Association of County Health Officers. She's a certified emergency manager and has established a comprehensive response network across Westchester in response to the Ebola threat. Dr. Amler is a mentor to rising youth professionals, steering them into schools, of medicine, nursing, and public health so that they may enhance their careers and reach their potentials. We'll also be joined by the Assistant Commissioner of Health, Dr. Peter DeLucia. Peter oversees food protection, foodborne illnesses, bathing facilities, lead-based paint, healthy neighborhoods, adolescent tobacco use preventions, tobacco-free work sites, temporary residents, West Nile viruses, and the administrating health hearing programs. And the third person that will be joining us is Dr. Deborah Spicehandler. She's an infectious disease specialist in Armonk, affiliated with Northern Westchester Hospital, and been practicing for over 20 years. So these three will be joining us for a discussion as well, and giving us expert tips and advice on how to safely reopen. We at Sunrise Solar, we're a construction company. We were able to reopen during phase one. Advice like that is very helpful. We've been trying to manage the minefields of reopening now for 2 weeks, and I can tell you it's not easy. Trying to reopen up a business, dealing with the income, the cash flow that comes in from business during a period where you don't have the same cash flows as you might have had before, and you have to deal with all the safety concerns. It really is a minefield, but it's something that the amount of success you can have is great because there's a lot of business out there right now. So these types of advice that we're going to have today and next week is invaluable to getting us to be successful. So I look forward to it all. Look forward to today's discussion and next week's. I think what the town and the chamber is doing to help us is immense. And I look forward to today's program. So Dawn, I'm going to turn it back to you to kick today's program off, and thank you, everyone.
All right, so now let's dive in. Thank you, Rand. A little bit about our two experts who have both been focusing their professional services on helping businesses reopen safely and appropriately aligned with the guidelines. We'll first hear from Louise Weddock, who is President and CEO of Access Nursing Services, a leading provider of healthcare personnel to hospitals, homes, and prestigious healthcare systems for almost 40 years, and recently launched the COVID Clear screening program designed to simplify new requirements and protect the health and safety of employees. Then we'll hear from another perspective from Michael Whalen, who is VP of Commercial Services at JP McHale Pest Management, now offering the ViroClean disinfecting service, a COVID disinfecting and sanitizing service that kills COVID-19 and other viruses on inanimate environmental surfaces such as floors, walls, structures, ventilation, and other equipment. JP McHale has been serving homes and businesses in our area and throughout the New York region for over 50 years, specializing in eliminating pests through biological, environmentally sensitive methods, and now including remote technology options for both residential and commercial properties. So both of these experts can talk from two different areas that we need to know about in order to reopen as required, actually. So I'm going to turn this over to Louise, who I know will be going over CDC guidelines specifically. So I'm excited about that. So Louise, we're ready. Oh, you know.
Oh, there you go.
There you go.
Okay.
There you are.
I was going to say, yippee-yi-yay today, right? Westchester, this is their first day. And so I thought Access Nursing recruits nurses and provides them within any environment of care. So within the COVID experience, we were first called on to start doing COVID screening. This was back in the end of February, early March. And then, oops, there's no tests around. because CDC had botched those tests. And then Northwell actually sucked up all the rest of the tests. So there was not a lot of tests for the city hospitals or employers. Next thing you know, everybody looked up and the lines were going out of the emergency rooms. People were just falling out of their cars into cots. And we're called in to provide trauma and emergency room nurses, then ICU nurses, then ventilator nurses, then dialysis nurses. And now, no surprise, we're big right now providing nurses in the nursing home environment. And all the while, America is trying to struggle to get back to work. And because of all the work that we've done in this COVID area, we've been getting a lot of calls. As a matter of fact, the call I just got prior to here is that we're going to do all the COVID clearance for the Mayo Clinic and all the different sites that they have around the country. So COVID clear is different from Ebola. COVID-19, the coronavirus, is different from Ebola. It's an airborne virus, different from AIDS, but similar to H1N1, the swine flu, and really actually just a really, really nasty version of the normal seasonal flu. What this uniquely has is an ability to catch on and clot in your heart. So we mistook 50 deaths in an emergency room at Bellevue one day, 20 being COVID respiratory, 30 being critical care. So this is serious stuff, let me say. I mean, what they learned is when people died or as they were dying, they were putting off a vapor, a fume that the clinicians were absorbing. So I just want to say physical distancing, all of this is like, yeah. And it is some of, yeah. But the fact is this germ is nasty and we've seen too many die from it. So, but we've got to get back in the game. We have to get back into life. And we have to build up an immunity. So anyway, physical distancing is one of the, what's the problem? Oh. Physical distancing is just, really, they didn't even open up the pools yet. And there's nothing allowed in any kind of game room, pool room, or anything else. Phase 2 allows professional services, nonprofit entities, technology, administrative support, higher education administration for businesses to start opening. And if those businesses that are big chain businesses have a front office, they can open. Campuses can open their administrative offices, but other businesses cannot open as yet. Elective surgeries are allowed to be done by hospitals as well as outpatient surgeries, docs in a box, and essential workers like nurses. In the protective equipment area, which, hold on, let me just see, wait a minute. Okay, so what they're saying is no more than 50% of your maximum room capacity can be used for your personnel. And I think that, it's going to be really hard, but you're going to use the advice right now, and this is what they're doing in the hospitals, is using file cabinets to, much like you see in stores, to create a directional pattern of traffic so that people are separated, as well as you can, in a sense, you go in one way to the coffee stand, you come back out the other way. You're not crossing and breathing and saying hello. 6 feet. I, actually ran a party one time and had 6 feet sticks that I had people just kind of as an activity to be aware of how far 6 feet is. People really aren't. So the use of spots and dots and X's, again, what you see in the retail stores, these are the regulations that they're going to want to have in the business workplace. Now, it's interesting because we've been asked to come in COVID clear for people who are in office buildings, but then they feel like, wait a minute, why am I COVID clearing my employees when they get up to the 14th floor? Shouldn't the office building be COVID clearing at the front gate for their employees, and then social distancing from there? And so the challenge really sits among the landlord and the lessee, in terms of how they're going to handle social distancing in the common areas as well as hygiene. Tapes and signs, directional. They're saying close down any small pocket spaces. Like, I know I have a little small kitchen area that everybody has a tendency to coffee around. And so they're saying tape those guys off. I think nobody wants a business to shut down. Really, I don't think that's what the health department really wants to do, but they want you to think in a logical way. How can you keep people's mouths away from other mouths? How can you deter traffic that we're not talking directly at one another? You're already doing it right now by saying, hey, rather than have people in meetings, why don't we keep them in their office and they can look at their monitors and talk from their monitors at work? Rotate shifts just to keep social distancing. Shared bathrooms and workstations. I mean, that's really, it's not a pretty picture. And shared workstation, it's got to be the responsibility before and after in terms of cleaning. One product that I find particularly effective, and it's often forgotten, is hydrogen peroxide. Hydrogen peroxide breaks down coronavirus instantly. Takes about 20 seconds with alcohol. So, it's a, very, very strong and effective kind of solution. But when you're rotating in space, you're obviously dealing with people who are, at most risk. It's the most risk space as well as the bathroom. So they're saying consider, and I know most law firms have stopped non-essential travel. And if you can keep your employees at home, working at home, keep them at home. I have to say, I saw this coming. I have a master's in public health from Hopkins, and I love this kind of stuff. And so when I saw it coming, I sent my people home back in February. It's like, why do I need to wait to see if somebody in my building is going to get sick? Why do I need to wait until somebody in my office is sick? Go home. Maybe you don't have a common coffee bar anymore. Maybe all meetings are outside from now on. Declutter. This virus sits on paper far longer than it does on a hard surface. So declutter. When it gets to protective equipment, I have to say I'm in the healthcare industry, and it's a big debate now. Does the employer provide healthcare equipment or not? Is it his job or not? Now, we solved that problem by supplying neckers and a promotional, access nursing, base level ski necker to our employees. Now, it's a base layer. It's better than nothing. But if I was going to go into Bellevue ER, I'd be wearing my base layer plus a surgical mask, or 2 base layers. So, if an employer is going to give a PPE, I think you don't have to, if these are permanent employees, give them permanent PPE and ask them to wash it once a week and wear it only at work. If they're exposed to a lot of people, then clearly they're going to want to have more than one PPE, or it's some external layer that is more disposable for them. This virus hangs on. So, you can spray it again with hydrogen peroxide. You can spray it again with Lysol. I suggest your face not be in there when the Lysol is going in, but it's to be taken seriously. Your mask is your best sword, more so than gloves. Washing and soaping is the best. So what can an employer do? I'd say, put a lot of Purell all over the place. Make sure that people are in the habit of spraying. CDC, or actually DOH, is asking for logs to be filled out, completed, and submitted. I don't know if OSHA is going to be surveilling that log. But what we're finding also is that people wear their mask, and gosh, and I don't have one, I should, but they're wearing their mask underneath their nose. They're wearing their mask underneath their chin. They're wearing it off their ear, which is fine if you want to talk temporarily. But every time you have the edge of that mask rubbing on something, it's going right back to your face and you're going to bring it in. So masks should be, kind of protected and put in a pocket environment, tucked away in your bag, pulled out only when you need it. As an employer, I'm telling all the employers that we're COVID screening, give one mask a week if you're going to give a mask. If they're in touch with different people all day long, then I would say 2 days. Hospitals, we're asking nurses to hold on to their masks for 36 hours. And that's in the most intense environment. So, it's a judgment. KN95 versus 95, the quality, you know what? The fact is, any mask is better than no mask. And you as an employer, if you see people that are just kind of chumming around, we know who those characters are. They should be wearing a mask all the time. Or you sit there and create a 6-foot barrier so that they don't get so close. And most of the time they'll be outside of people's offices now. But those are the people that are really kind of the dangerous ones. Why? They're like bees. They go from flower to flower to flower to flower to flower. And they could be the most immune one. So your biggest vector is usually immune. Okay. Require your employees to perform hand hygiene before and after any kind of contact. Spray every object that you can possibly spray, and have all those supplies sitting around. And those supplies, if you're ordering from Amazon or anything, expect them to take a while on the delivery. Adhere to, I really didn't realize this, but that you have to have a cleaning log, and on each site, dating the site and documenting the time and the scope of cleaning that was done on that site. And then your hand washing protocols have to be a part of your training now. Sanitizers, disinfectants. Apparently there's a whole list that's available by the Department of Environmental Conservation. Those are the approved products. I don't think that anybody's going to come in and rip your Chinese product out of your hand. I think, but these are ones that they're endorsing and recommending. And then frequently touch surfaces. I don't have to go that. You need to communicate. And, we know how regulators work, and they first go to your website and they see what's going on. So what they want to say on your website is they want you to have some kind of an affirmation that you are on board with these phase 2 guidelines. Develop web pages, text, email groups, social media campaigns to provide information to workers, customers, visitors that include instructions, training, signage, and information. I mean, so much so that you're just, they're choking on it. They can't get away from it. Social distance. So, I anticipate the big fight here. You're talking about signage, your landlord or the building manager, has to be the one that's going to help out in that stuff that sits outside of your front door if you're in an office. All personnel need to have new training protocols, and you need to frequently provide updates to those guidelines. I'm going to get into the screening aspect of it because, it really, that's where the work piece of it happens, meaning that, if someone was at a party last night and then found out that the person they were with has COVID, and now what do? They feel fine. They don't know what to do. So they call their employer, and their HR department or their boss turns around and says, oh, well, we really need you today, Joe. Come on in. And actually, Joe really needs to, in a sense, take a little bit of responsibility and say, I was exposed. I need to self-quarantine. I know it hits his pocketbook, but he should be self-quarantining for 14 days. I, as an employer, actually gave an additional 5 days for COVID leave. Anybody who was sick, came back with a diagnosis of COVID, they got 5 extra PTO days. Does not have COVID symptoms, but tests COVID, we know that they got to stay home for 14 days. And then clearly, if someone is sick, then stay home. We've developed a technology through our clock in and clock out system where our employees, all our caregivers, nurses, on my staff, even myself, we get a text every day, and that text prompts us to answer a questionnaire. And then we, submit that. That then gets a response that says you're clear to work or you're not clear to work. And so, it's, if you can get an advance notice and you get your people oriented to, anticipating whether they have COVID or been exposed, take their temperature on a usual routine level time in the morning. And then, an employer should be screening at the front door. And then moving on. The questionnaire is your own decision as to whether you want to do the CDC questionnaire and follow it all up. But screening is a very big part of obviously the COVID clearance program, because it's just because you were clear, I'm doing this big antibody screening right now for big team. And, just because you're clear one day doesn't necessarily mean you're clear the next. So screening, whether you're talking antigen, antibody, temperature, pulse ox, or just your general symptoms. We all know we can get to work in the morning feeling great, and then, oh my God, halfway down, you come down with something. We never knew where we got it. So anyway, that's my review of the guidelines, my suggestions for any kind of tips and tricks along the way. And if you anything else I can help you with, I'm happy to. I guess I lost them.
Did you want Lyle to put up your PowerPoint, the one about the COVID clear, or do you?
I think I pretty much covered. I mean, if you want to, you have time. I don't know.
Lyle, or should we do that with questions?
Yeah, I think we should do the questions and maybe go to Mike.
Yeah.
Okay, let's do that's fine. Okay. So Mike.
Thank you, Louise.
Mm-hmm.
Nice
Thank
job.
you so much. Thank you. And we'll go back with questions and more specifics. So now we have Mike Whalen, who's going to talk about keeping your workspace clean and sanitized and meeting these guidelines. So on to you.
First off, nice job, Louise. We were fortunate to where JP McHale was listed as an essential business. So we never stopped, but we had to kind of incorporate a lot of those practices into our business, because even though we downsized to a skeleton crew and a lot of our non-essential workers work from home, we did have to start putting some of these guidelines in place. And the guidelines are ever changing, they seem. So you kind of have to look at what the guidelines are and try to make sense of it, of how it's going to impact your business, and make the necessary steps. But some of the things that we've done with, just the posting in various areas throughout the offices about washing your hands, having different sanitizing products available for our employees to use. Coming back into the workforce, it's kind of lowering the guard. And I think that our goal at JP McHale is here to help you guys provide that safety for your employees. So just great job with the presentation. But my name is Mike Whalen. I'm Vice President of the Business Development for JP McHale. Jim couldn't be here today, so he asked me to come in and help discuss some of the things that we're doing to help. I mean, we've always been in the public health sector of the business from a pest control standpoint, protecting people from various diseases, from pests that they carry. Some of the biggest plagues that the world's ever experienced came from a pest perspective. So we're in this public health business as well. And now with this whole COVID-19, it kind of falls into our business and what we do. JP McHale, in addition to providing pest control service, also has an environmental division. So we've always been doing rodent abatement, rodent cleanups, pigeons, birds, various different types of cleanups, fighting different types of viruses and diseases. And obviously, since the COVID-19, we've been doing the disinfecting in offices and buildings and food processing. Just to touch base a little bit about who we are, if anyone is not familiar, that I doubt it, but JP McHale is, lost my screen there. There you go. We're a pest control company in New York State. We've been in business for 50 years. Recently, we've joined an organization called Anti-Cemex, which is a global network of pest control companies. So we have a very large bandwidth of pest control and just knowledge, which is so powerful. When this COVID-19 started to hit our world in other countries, we started hearing about it. Some of our other Anti-Cemex companies in Italy started giving us some information. So they've been a little bit ahead of us as far as the recovery, and we've been fortunate to be able to partner with them and have some information. But we also have a branch in New York City, as well as Long Island, and we provide, obviously both commercial and residential pest control services. We've got a 200 team member staff, and we're on the streets every day, taking care of pest control, and in addition to disinfecting services and tree and turf as well. Our business, from a commercial perspective, you name the industry and we're in it, from a healthcare perspective, hospitality, education, manufacturing, financial, very, very diverse in the types of businesses that we were in. And we've seen, obviously, all the different businesses hit in different ways. Some businesses have closed their doors, put a pause button on their pest control services. Some of them stayed open, and we've been doing a lot of the disinfecting services in a lot of these businesses that have stayed open, because their employers want to provide a safe working environment for their workers and ease their mind about what they could possibly catch from coming to work during that day. And as this, CDC evolves and these programs evolves, you're going to need to have a good plan in place, like Louise mentioned, about keeping your facility clean, and whether that's incorporating. I think George from Arco Cleaning's on the call. Cleaning certain areas, whether it's carpets, to providing a disinfecting service, whether it's something you're going to try to do on your own, or periodically you're going to bring a professional company in to do a full service. The emotions are running high. People are definitely on edge. I know for myself, once this all hit, coming back to work, you're kind of looking and seeing what your company's done for you. and you want to be able to provide some type of normalcy, lower their guard, make them feel comfortable for the people that when and if they have to come into work. And it's important for us to have those things in place for us. So you could go to the next screen there. Why is disinfecting vital? Obviously, employee safety, public health that I talked to earlier. Even from a pest control standpoint, when we look at how to have a good pest control program, sanitation is key. You want to have an environment that pests can't thrive in. And it's the same with this. You don't want to have this virus out. You don't want to have these things lingering. So it's important to be clean and keep your facility clean, making sure that you have a plan, and obviously mitigating your risk. That's the critical part, especially as your businesses grow and you want to move forward. So what is our ViroClean misting service? What we do is we perform a misting application using a viricide material that kills the COVID-19 in addition to other viruses that are out there. The key is to making sure that you are hitting all areas that people come into contact with. So it's kind of a two-prong attack where we come in, we perform a hard surface wipe down of all areas that, again, people are going to come into touch with. Your desks, your chairs, your doorknobs, your door jambs. If it's a cafeteria, your countertops, your vending machines, your restrooms, your door handles, any kind of handle, anywhere where someone has the ability to put their hand, we perform a hard surface wipe down with a disinfectant that needs to stay wet for a period of time depending on the product. That's the important thing. And we were involved with the city of New York with some of the work they're doing in the subway stations, and they were actually testing to see how long surfaces were staying wet. So it's important that you perform it according to the label of the product, and we do that. After you do the hard surface wipe down, what our specialists do is we have these machines that break up and we perform a misting and a fogging of the air. And what happens is the disinfectant will hit the air, will affect any kind of bacteria or virus in the air. And as it settles and it lands on softer porous materials, it kind of sets on there and it'll settle in. Obviously, if there's a puddle or anything, we're going to wipe that up. And there's generally a 2-hour re-entry after we perform our service. So it's very detailed. A lot of companies are getting into the disinfecting that weren't into it, looking at it as a side business. One of the things that we've heard from our clients compared to what they've also seen is that we are very thorough. And I think that goes back to our genes that we're in the pest control business. And to be effective in pest control, you need to be very specific. You need to be very thorough. And our guys are kind of taking that same approach when we're going through, whether it's a school, whether it's an office environment, whether it's a locker room for an employee, whether it's a facility, and doing it. We're getting a lot of calls from people looking to perform a service prior to them opening. We give a certificate that can be posted for everyone to see, showing that the facility's been disinfected on the date. And we obviously provide SDS materials of materials that we use and so forth. And it has created a very positive experience from our clients. In New York, several hotels were housing doctors and nurses for the various healthcare events, whether it was Tent City or over at the Javits Center. They were using these hotels for staging areas. We were providing disinfecting to them on a very frequent basis, and it was working very effectively. So it's something that our business and our world has changed since this. I think that we all have to have a different approach as far as the social distancing, which is critical, but also making sure that we have the right protocols in place as businesses, that we're providing safe environments for our people to come in and work in. And providing a disinfecting service is something that does that. In addition, if someone does test positive, we're getting a lot of calls to come in and treat those working environments. And it's nice to have that plan in place for when that happens. Some of the different areas that, you know, we treat, kitchen areas, HVAC systems, smoke detectors must be covered. That's a prep thing that needs to be done. But we really wipe down a lot of the areas with the disinfecting. It doesn't stain anything, so it's effective in that. And the main thing is obviously you need to be out of those areas after we're done. Go to the next slide there. Just, why JP McHale for disinfecting? We're licensed and insured. This is part of a business offering we've been doing for a while. Services, we could obviously, bundle this with your pest control if we're doing it there. Another thing that I want to touch on too is one of the things, in addition to employee contacts, is how you're coming into contact with various vendors that you have. And we have a new electronic monitoring program that provides pest control without technicians having to be on site. Technology obviously is affecting all of our businesses, but this is some new technology that was very big in Europe, and it's hitting the streets in US, and we're the provider for it. And it's very effective because our technicians don't need to come into contact with your business. We could have equipment in place that does pest control for us. And we see that as being very big, whether it's your home or your business. It's the Anti-Cemex Smart service offering, and we're starting to get nice traction with that with this pandemic coming. So in addition to that, all of our services are guaranteed. McHale's is a righteous company that's been doing the right thing for 50 years, and Jim McHale and his family have really plowed the way for being leaders in our industry in New York. That's pretty much it from my end. If anyone has any questions, feel free to put them up on the chat.
Well, thank you so much, Michael and Louise. If anybody has, as Michael said, if anybody has questions, please put them on the chat. I had one observation and question. I think a point that Michael, you mentioned is the confidence in terms of customers and employees. A big issue is, yes, we're reopened. Yes, we're following guidelines. And this is for Louise as well. How do you, this is for both of you. Yes, we're open. Yes, we're following guidelines. The space is clean. We've cleared, we're checking our employees. How do you, what steps can you take further to reassure employees and customers that it's safe to come into the store, to come back to work?
We've had a lot of hospitality accounts that we've worked with, and then they've asked us to get involved with developing a plan for them that they can share with their customers, whether it's a restaurant or a hotel, really letting them know through whether it's social media or through their website of what their COVID-19 response plan is. And, it's, years ago, you always went to the bathroom and you saw that little log on the back of the door that, said restroom was last cleaned and having a protocol.
Right.
Well, it's going to get blown up now to where, this type of material needs to be public. And, with social media, it's very easy to get your message out there. And I think as a business, you're going to want to get your plan out there better than your competition, because that'll show a prospective client that these people have their act together, and I want to do business with them because they're taking this serious.
Absolutely. And Louise, you're on mute.
Okay, sorry. It's interesting because, we're in the business of caring, and how do you provide care without touching? So, and for a business to extend themselves to the client, how can they extend themselves without touching? And I think that there are ways that we can really, I don't think we sit there and lament the old way. I think we throw that away and come out as a whole new thing, which may end up being what JP McHale, ends up being, or us with COVID Clear, brand new service line, that we end up, providing to corporations. But I think anything that you can do that's going to avoid touching, anything besides your own stuff. We long got away the common coffee cup. You bring your own cup, you use your own coffee. That's the way it's going to go. You wash your own coffee. And, or in this case, I don't know why, we have disposable menus for the restaurant. What do you mean a disposable menu? Go to my website, click on the menu and order from there. I mean, people do that before they go to the restaurant just to see what they have going. I just think that any opportunity that, spraying, you should carry a case with you. You carry stuff, you're coming forewarned and forearmed into any situation. Most of all, wear a mask. Gosh darn it, and wash your hands.
Mike, George Arco had a question for you about ultraviolet light disinfecting.
Sure. There is a lot going on in the New York City market regarding that. We were involved in bidding on several trains and subway stations in regards to that. They're saying that it is working, but we really don't know, where the city's at with it. I'm sure there's a high cost to it. We're not, providing that. We're just using the disinfectants with the hard surface wipe down and the misting at this time, but it definitely could be something in the future.
Thanks, Mike. Back to, I just want to go back to Louise with the question that I had about confidence. And can you go through what the process is to clear employees to go back to work? Do employers now have to take the temperatures of their employees every time they walk in the door? How does that work? How do you know if you have someone coming back that's sick, that's not going to wipe out your entire team?
Well, I think that is the concern, that someone sick could wipe out your entire team. But they're asking that you screen. And screening, it comes in a variety of different ways. I say to employers, actually, Dawn, you can get that presentation, because I ask employers, really what you want to know is, are you contagious right now? And so an antibody test will tell if someone, had it before, therefore not likely to, have an active viral case that's going to be spreading. Not that they couldn't spread. And so an employer can feel more comfortable with that employee. To say you don't have a fever now, at the door when you're gunning people, when I say gun, the remote thermoscan with what looks like a gun. And let me just say, I think Braun has the best product that is out there, with the fewest false negatives to it. But anyway, so if you're gonna, scan them, and that scanning is going to determine whether they go to work or not, I think that, that demonstrates to the employee that you are taking an aggressive stance against this, against this virus, an aggressive stance for them. I think on a Monday morning, it's a perfect time to extend then their package of PPE. If you really want to get obsessive about it, you can get into an employer can turn around and offer an antigen test to the employee on a Thursday, and be able to have the results. The employer will have that result of the antigen test by Sunday night. and they'll know on Sunday night based on lab results. And now the results are turning around a lot quicker. But the most affordable one, an employer can have a result on their employees on Sunday night. And then that employee knows not to go into work on Monday morning. So you could have pre-testing over the weekend. You could have technology clocking in and clocking out prior to the employee coming in. None of these things say anything to the consumer yet, because this is still so behind the scenes. So really, just as Jim said, you really have to tell people what your safety program is and how important it is for them, and because it is a life or death situation. And if we as providers to protect, as the protectors out there, if we don't beat that drum, I say, how long did it take America to put seatbelts on? Oh my God, we're so stubborn. So stubborn. Now we have them for our dogs. So, here we are. America, wear your mask, wash your hands. But I don't think we're at that point now. The employer is, unfortunately, as Jim and Rand said, they're being so hard hit by this whole damn thing. And so to ask them to pull out of their pocket and pay for a nurse to sit at the front door, and implement that safety plan and get that log and get screened and do this. It's really hard to do, really hard to dip in your pocket and do. But the fact is that people are scared to go to work. Mm-hmm. I've had 2 people resign on me because I've told them they need to go back to work. It's like, oh, I'm not going back there. The government, I don't care what the governor says, I'm not essential. Really, and so there's real fear out there. And we need to get through it. I think the shopper, put your goods on the street and then entice them inside. But, get them through your door only on those bare essentials. Even grocery shopping, people have a rotation of friends that go and get and, do. I don't think we're quite ready yet for the shopper to go into the store. Restaurants, I feel sorry for them. On the inside, on the outside, I'm going to one tonight. I'm so excited.
I think what you're saying is right, Louise. And I think that's why your businesses are, both of you are really important right now. They're essential in terms of the service, but I think in terms of people's headspace and giving people comfort at this point. I've said that I thought we should have, as one of our speakers, maybe we'll do that in 2 weeks, a psychologist, because there's so many studies out. There's so much fear out there to go back to work, to go back into the stores, restaurants, get haircuts, the whole thing. And that's why, not only are your services, functionally important, they're also important just on that, for that other aspect. People want, you can't they say you can't guarantee things in life, but you want to get, in this case, when you're hit with something like COVID-19, you want as close to a guarantee as you can get, which is where you guys come in. So,
right now for 18 months, hold on for 18 months. Be good and behave for 18 months. And when we get, an vaccine that's an effective vaccine, then we can move on and be the buddies that we used to be. I'm a hugger, I'm craving. Thank God my man's a hugger back, but he's like having a good time this time. But life is it is different. We need to behave in a different way until we're told we can go back to another way. I watch TV now and see these old movies with people crowding up, and it's like, oh, stay away. That's a little different.
It's like an alien world, right? Like going to Mars when you see that. Mm-hmm. So almost 12:30, and in closing, maybe we'll, since Louise started, we'll go to Mike, and you could have your closing remarks and, talk about how people can get in touch with you, and then shift to Louise, and she can have her closing remarks and can get in touch with her company.
Sure. My email is mwhalen@nopest.com, or you can just reach out to the McHale and ask for Mike Whalen, our office up in Buchanan. But I think, this was very beneficial. Louise, you had a lot of good information there. And I think that, we have to learn as we go with this, and we have to make smart decisions and try to stay ahead of things as best as possible, and mitigate our risk as business owners, because we have to stay away and keep our employees happy, keep them productive. Happy employee is a productive employee. So that's it. Thanks for the opportunity to present ourselves here. And if anyone needs anything, reach out to us. We'll be more than happy to help.
Absolutely. Thank you for the great information. Okay,
The more we know, the better we do.
Yep.
So I think that, it's incumbent upon the employer to distribute any kind of educational materials constantly out to the people that they touch, both employee and customer. I think it sees you as responsible, but also too, they look to you to be a credible and informative source. Right now, I do think the employer needs to step up and, do an ambassador piece and put your logo on that face mask and give that mask to your people in full pride and welcome them to your team and your customers to your door. You don't have to spend a lot of money. If you put a hairdryer, I went to a deli and they had a hairdryer at the front door. Hairdryer, 10 seconds underneath the hairdryer, high heat kills corona. So there's ways that you can convey the message at the front door that doesn't have to cost an employer an awful lot of money, but I think you have to show force. Really show force. You are not going to put up with this in this environment. You pay your employees, and just like a mother putting a child in school, an employee comes to the work environment believing he will be safe unless he's advised otherwise. And I think that this is not safe right now, and we have the onus to make it safer, as safe as possible. They have a job to do too. They should be wearing their mask. Go ahead. That's it. Oh, call me. Access Nursing at 212-286-9200. 212-286-9200. COVID clear.
Thank you so much, Mike and Louise. This was really informative, really timely. As phase one, as Rand knows, is now a thing of the past, and we're well into phase two. I want to thank everyone for signing on, and thank you, Rand and Lyle. And I hope to see everyone next week. We have a great program with Dr. Sherlita Amler and Dr. Spicehandler. And also want to mention that if anyone has a topic of interest, this Lunch and Learn series is for you. And it's for you to pick up even just one good nugget that you could take away with you. It's completely worthwhile to be here. There's a lot of information out there, and to be able to hone in like we did today on some really good info that you can take with you and implement in your own lives and businesses is important. So if you have that and you want to share it, please contact me at ddr@ddrpr.com, and would love to have you present and love to have your suggested topic. So thank you very much. Lyle, do you want to have anything to close?
No, I have it in the chat. This is available on YouTube. So if you want to come back and read any of it or listen to it, You can go to the YouTube link in the chat. And we have all the lunch and learns up there. So there's one from prior weeks that you're interested in. And one specific one might be the one with Keenan Bean on employment issues in COVID that was done last week would be really useful in terms of people coming back and what your legal obligations are and what theirs are. And it sounds like Louise ran into it already, a couple employees. And
Yeah.
That's right.
but thank you.
Thank you. Ram, do you have anything you want to say?
No, my one last note is I'm getting a haircut today. It's
Yeah.
available now
I
in
think
town.
it looks good.
But it's available now, so go use your local merchants and let's get
There you
haircuts.
go. That's what I say. Go local.
Take care, all. Great to see you.
Thank you.
Thank you so much,
Thank you,
everyone.
Don. Take care.
Thanks.
Keep up your good work.